And with the benefit of treatment and the acquisition of social skills and exposure therapy and relaxation therapy, you can expect a significant improvement, if not a recovery.
So, Dr. O'Sullivan, when we're talking about social anxiety, as a psychiatrist, what are the skills that you advise can be developed to help people overcome social anxiety?
Self-observation. Become more aware. Become more aware of the way you think. And this relates to cognitive therapy. What are your thinking patterns? Do you tend to be negative in your thinking? Exaggerating the negative? Worrying excessively about things? Anticipating the worst? Track your thought patterns, get to know them, and then learn to replace them with more adaptive, healthier thinking patterns. The next step, I think, is get to know your anxiety level. Learn to manage your anxiety. Acquire the skills to be in control. And you do this with meditation, relaxation exercises, mindfulness practice, yoga, so that over time you develop the confidence that you no longer are overwhelmed by anxiety disorder. Then I would move on to social skills training, counseling or coaching in social skills, so that you acquire the ability to interact with people in public, and that you can interact in a self-confident way, be able to participate in conversation, and forget about yourself and become engaged with other people in a social situation. And finally then, we talk about exposure therapy. So you have a problem with a certain social situation, overwhelming. Break the problem down to small parts. Learn to face the problem or the situation by degrees, using the skills that I've just described. And then over time, work on part after part until you have successfully dealt with the total situation. Now, for some people with severe social anxiety disorder, they may benefit from a day hospital program or group therapy, where they have the opportunity of interacting with other people with a similar problem. And this can have a profound effect on people and can be very effective.
Could you give an example of skills development, in particular maybe exposure therapy, of an example of someone going through that, how that would work for them?
For example, sometimes a person, to their embarrassment, are unable to go to family functions. They avoid a wedding or a christening or even a funeral, and this can be very distressing. And they're perceived by the family as being uninvolved. So in a situation like that, a person can receive coaching on how to interact with another person, with one or two people, or in a group. The questions to ask, the style of interacting, the body language. And over time, coaching can impart skills to that person and their confidence improves. Then the patient, the client, can start exposing themselves to family functions that are not too intimidating. Maybe a weekend get-together, a barbecue, a social outing, and over a period of months, gradually increase the challenge as their confidence improves, so that they're able to go to the family wedding and maybe even give a speech at the family wedding. And I've seen that happen with people. So approaching it in a structured way, exposing yourself to doses, increasing doses of the triggering situation, and with time and confidence, over a period of 6 months, 12 months, or even 18 months, overcoming the problem.
And when it comes to medications, what medications are commonly used to treat this issue?
Commonly tranquilizing medications and antidepressants. Tranquilizing medications are used for immediate relief of anxiety and for short-term treatment. Longer-term treatment, the physician usually looks at prescribing antidepressants, SSRI antidepressants or SNRI antidepressants. Now, it's important, though, that if we are considering medication, that, again, the problem is assessed by an expert. Mm-hmm. And we use medication for those cases of social anxiety disorder that are severe, overwhelming, incapacitating, or cases that are not responding to counseling and psychotherapy, or finally those cases where we become aware that it's not just social anxiety disorder, that there are other issues previously hidden and are now coming to light, like depression or alcohol dependence or OCD or panic disorder. Then medication is considered as an option. And medication, of course, should be prescribed by a physician who is knowledgeable about the medications, knowledgeable about the issues that may arise, like dependence, habituation, addiction, or side effects, or the interaction that these medications may have on the medications that the person may be taking for high blood pressure or asthma or kidney disease, that type of thing.
And have you seen people recover from social anxiety? Can you grow out of it, for example?
Well, yes, you can. For some people do recover. And I mentioned, as an example, teenage girls, adolescent girls. Often they spontaneously recover as they mature, as they're exposed more to life, as they have more success in life. They find they acquire the skills and the confidence to function. Many people do. Some studies, not all, but some studies have shown that up to 50% of people with social anxiety disorder recover. Many don't, of course, but treatment makes an enormous difference. Treatment helps. And with the benefit of treatment and the acquisition of social skills and exposure therapy and relaxation therapy, you can expect a significant improvement, if not a recovery. The other side of that coin is, without treatment, social anxiety disorder can become a chronic condition, a lifelong condition, a disabling condition. And that has a very negative effect on morale and self-confidence and the quality of life. In addition to that, there is the danger of developing other psychiatric disorders like depression, as I mentioned before, or alcohol dependence, because often people self-medicate with alcohol or develop panic attacks and become socially restricted. So treatment is important, first of all, because it often works, but secondly, it prevents the development of chronicity.
Thank you. It's encouraging to know that social anxiety is a treatable condition. We're next going to talk about people talking about social anxiety. Should they share about their social anxiety? Thank you.
Thank you.